So what insulin are you on?
Lantus.
Lantus?
Yeah.
I heard you can die from that.
Good morning, ma'am.
That's why I'm
Miss Tron, is it?
Yes.
Okay, so I have you for an appointment this morning by 10 o'clock to see the doctor. Okay, I would like to take it to the next room. So you can
Okay.
see it.
Okay.
All right then. How you feeling this morning?
Okay, kind of nervous about seeing the doctor and the pharmacist.
Okay. So before we get started, I would like to see your blood pressure for today.
Okay.
You know how you're feeling, so get your blood pressure in. Okay, so do you like the weather this morning? It's kind of cold.
A little bit cold.
It has been cold. Yeah, you know, it's crazy, but
I know, one day it's raining, the next day it's sunny, and then it's snowing. You just never know.
Okay, so breathe down. Good, great. Do you check your blood pressure often?
Only when I go to the doctor's office.
Okay, you should have one. You should get one person who wants to check it out. Okay. Sorry about that. All right, we have that for you. And all right. So you have your ultrasound file. Is what again?
3300 Cleburne.
All right, that's correct. So the phone number is it changed?
It's still the same phone
It's the
number.
same phone number. That is 832-555-2121. Okay, that's good. All right. So do you have anything else you want to tell the doctor?
Okay. Just tell her I haven't been using my insulin because I'm scared of the needles.
Okay, I'll put it in there. Okay.
Maybe that's why my test might be a little bit high.
All right, all right then. I'll be right back.
Okay, thank you.
Hi, Miss Strong.
Hello.
Hi, it's good to see you.
Nice to see you again.
You remember me?
Yes.
Dr. Guillory, your
I know.
primary care physician. Well, I'm so happy that you're here today. And you remember on our last visit, I told you that I was going to get together a healthcare team to work with you to help you better manage your diabetes. And so that's what we're going to do today in this visit. I'm going to introduce you to those team members, and you'll get a chance to talk to them about those things that concern you with your diabetes. Now, I'm going to tell you, I did get the results of your test back that we took. You know, we drew blood.
It's bad.
I wouldn't say bad.
Okay, but it's
It's
not
just
good.
something that we're going to have to work on together.
Okay.
Well, we tested the overall blood sugar level in your body, and it was high. It was 180, and we prefer for it to be 154 or less.
Excuse me.
So,
Actually, pulled up some more of the results with the patient.
oh, did you? Oh, great. Okay, thank you. Okay, yes, this is what I was talking about. As I told you, I thought it was 180. Yeah, I was right. It's 180, and we want it to be at 154. So we're going to work on that, but I don't want you to be alarmed because a lot of my patients come in with it rather high, and we're able to get it under control.
Okay.
Also, I checked to see what your fasting blood sugar level was because you didn't eat before the test, right?
No, I didn't.
Okay. And it was 8, and we want it to be less than 7, so it was a bit high. But we're going to work on that. Okay? One thing I'd like to do is there is a dietitian that we have here on staff that's going to come in to speak to you later, and they're going to work with you on that. And before the dietitian comes in, though, just so that I can give them a little bit of information, what types of food do you like?
All kinds.
All kinds?
All kinds, but especially carbs.
Okay.
Yes.
All right. Most of us like carbs. You know, and our diet here in the United States tends to be rather high carb. But, you know, there are options that we have where we can design meal plans for you that incorporate foods that you like that just have less carbs and less sugar, but they still taste great. So, but our dietitian, as I told you, you know, he's the expert in that area. But I'm going to share with him that you like certain carbs, like you like pizza.
Yes,
Okay, you know,
burgers
like spaghetti. And,
yes.
Okay, and lasagna, things like that. Yeah, fries. Okay. Well,
Especially fries.
okay, yeah, I think everybody does. But we're going to talk with him, and I'll let him know what you like, and then he'll design something for you. And he's going to come in and talk to you about that more in detail as well. He's also going to help us to get together an exercise plan for you. And a lot of my patients kind of cringe when they hear exercise. Yeah, I understand. But, do you get to exercise much?
It's about as much when I go get the mail from my mailbox and to my car, and that's it.
Okay, well, that's pretty common. Well, was there a time when you were more physically active?
When I was 30 pounds lighter and able to run and go swimming.
Okay, so you like to run and you like to swim. Okay, well, I will share this with our dietitian because he can ease you into a plan that works for you, where you can do the things that you enjoy and do it at a pace that works for you. Okay. I also, the nurse shared with me that you have not been taking your insulin, right? And don't, it's okay. Some of my patients do that at first. But I want to ask you, what is it that causes you to not want to take your insulin? Or has kind of interfered with your
needles? The needles are really long. They seem like they hurt.
Okay.
Someone told me I was going to die, and I don't want to die.
Okay. Well, I can understand a lot of patients have a lot of fears about a lot of different treatment plans that we give them. And we have an excellent pharmacist on staff that is our medication expert. And she's going to talk to you about these things, talk to you about your fears. And what I want you to do is be completely honest with her about what you fear and what you think and what you've heard, so she can fix all that for you. Okay? Okay, well, I'm going to step out and I'm going to go share your test results with the pharmacist, with the dietitian, and they will come in shortly and introduce themselves to you and talk to you about everything, okay?
Okay, thank you.
Okay, well, it's great to see you, but I will be back, okay? Okay, bye-bye. Hi, Ms. Strong, how are you?
I'm good. Nice to see you again.
Nice to see you. I'm Claudia, so I see you remember me.
Yes. I just hope you don't tell me I'm bad because I haven't been using the insulin like you told me last time.
Okay. You mind if I have a
Yes.
seat? Okay. I'll just move this out of the way. Well, I did see, so Dr. Guillory did show me some of your lab results, and we're a little concerned about your sugar levels of your blood being kind of high.
They're not good, right?
Well, I won't say that they weren't good, but they're not where we want them to be.
Okay.
So, and so I see that you didn't pick up your insulin. You did pick up the glipizide, though, correct? Okay. So what did Dr. Moshe tell you to expect about the Lantus?
That if I take it with the glipizide, it was supposed to make me feel better, but I didn't.
Sure. And that is correct. With the plan that we have you on is that we want you to use the glipizide in combination with the Lantus so that we can maximize the drug in your body and get your blood sugars down to normal. And I understand that there's a phobia, though, about the needles with the Lantus.
Yeah. Have you seen those needles?
I have seen
They're
the needles.
long.
Mm-hmm.
Okay, I mean, they're not that, but they're long.
Right. So a lot of patients do have phobias of fears, but the one good thing about Lantus, a lot of times what I've noticed with patients with fears of needles is that when somebody else is sticking them, then you kind of tend to tense. But when you're doing something to yourself, like women, we pluck our eyebrows and different things, it's not so bad because we have the ability to control it, So I think that it might be something good for you. But if we don't use it, then we're going to continue to see some of your blood sugar levels being kind of high. Also, I heard that you were afraid that the actual insulin itself could actually kill you. Someone maybe told you that. Well, I don't necessarily say that it's going to kill you. Actually, without you using it, your body is actually overworking. Some of your organs can be damaged because the blood sugar there can help you to live longer and a healthier life. So I want to try to look into some of those fears that you're having, see if we can get those to subside so that you can try to use those in combination.
Okay.
How does that sound?
That sounds good. Like I said, I'm just not used to poking myself with the needles.
So how did the doctor tell you to use the medication?
I should inject myself 3 times a day.
Okay, well, actually, the insulin, the Lantus, the one that we have you on, is actually only once a day, as well as the tablets. You're supposed to take those once a day.
Okay.
And so what we want to do is we want to try to use those together. So what schedule do you have in place right now that you do every day at the same time?
I take my dog to the dog hotel because I
Okay.
have to work.
Is that in the morning?
In the morning?
Sure. So what I would do is around that same time every morning, I would use the insulin and also take the glipizide, and then that way it'll be part of your everyday routine. You take your dog every day, so that'll be part of and walking your dog even walking.
Oh, that could be exercise for me.
Sure. So we can incorporate all that at the same time.
Okay. I make sound healthy sound so good right now.
It is good. It is good, and it's going to work out so well for you, and you'll see a great difference. And so, what did the doctor tell you to expect?
That I should feel better.
Mhm.
My feet pain should go away. So that's why I kind of stopped walking too, because it hurts to walk sometimes.
That is true. One of the side effects of the insulin is, a lot of people have pain in their feet. They also may feel tired. Weight gain is another side effect of having high blood sugars. So with the use of the insulin, the glipizide, you might even see some weight loss.
So I'm gonna look fine again.
It's possible. It's very
Okay.
possible. It's very possible. So how do you feel about using the insulin right now?
Oh, well, I mean, you said it's not going to hurt, so I can give it a try.
Sure.
I'll give it a try.
So I do have something.
Sorry.
Uh-huh.
I do have the refills.
Okay. Thank you so much, John.
You're welcome, ma'am.
So I have here the glucose machine that you're supposed to be using to check your sugar 3 times a day.
Okay.
And actually, the needle that we'll use for the insulin is close to the same pressure that you would feel from this.
Okay.
Were you able to use this at all?
Oh, I haven't used anything at all.
Okay.
Nothing.
Do you mind if I show you?
That's fine.
And actually, I want you to try to use it, because like I said, sometimes when we have control of things on our own, then it doesn't hurt as bad.
Okay.
So I have here this, and I'll just get a little needle and put it in there for you. And what you're going to do is you're going to stick your finger right here on the side, and when you do that, you're gonna press the button. It's gonna click real fast, and then we'll put it into the glucose, and then you'll get to see your actual glucose level then, or your sugar level at that time. So you want to give it a try?
Okay.
So just
alcohol.
So here's a little alcohol wipe.
Mm-hmm.
So just right here on the side, don't be afraid. Take a deep breath in, and then when you get ready to press the button, release the breath. Deep breath in, release.
That's it?
That's it.
Okay, maybe it's not so bad.
It's not so bad. And then like you see, it's just you controlled it.
Mm-hmm.
No one is inflicting pain on you, and it's a good thing. So the
Okay.
actual needle that you would use for the insulin is not much different than that.
Okay.
And you would, inject it here. We told you on your last visit you inject it here in your hip, or even in your stomach, whatever is comfortable for you, that you can manipulate and control on your own.
Okay.
So how does this sound so far?
That sounds good. It didn't hurt, so I'm going to give it a try.
Okay.
Promise you guys I'm going to try.
Sure.
I'll try.
So if you don't mind, just how are you going to be using medication from this point on?
So the glipizide, I'm going to take the glipizide once a day, in the morning, and also the Lantus, inject it in the morning also, all before I drop off my dog.
Sure.
Right?
That's right.
Okay.
And then you said you were going to incorporate maybe a short walk with the dog.
Okay.
Yeah.
Yes, I'll walk the dog to the hotel since it's just there, and I'll do that.
Mm-hmm.
And yeah.
Because that's good, because when you do all 3, you'll see a faster effect.
Okay.
Just when you're using the medications initially together, you may experience a little dizziness. So when you get up, maybe get up a little bit slower than you would. Don't just get up straight up, because then it might cause you to be a little lightheaded. You might experience a headache. But these are just mild things that as you continue with the medication,